Hello, my name is Temitope Shebanjo. In this short video, I'm going to be demonstrating NG insertion and removal, then ostomy care. To start with, I'm going to be doing first thing I will do is check PCP order and care plan. For the purpose of this video, I have my selling sum right here. I have my tape, my pen light, my mouth swab, safety pin, a cup of water with straw, a tissue, empties basin, and a towel. So I'm now in my patient's room. What I'll do next is I'll put all the equipment that I want to use in place. Put them in place. Okay. I've been able to gather all the equipment that I want to use. I will now perform hand hygiene. I'm going to put on a new glove. The next thing I will do is I'm going to provide privacy. I'll provide privacy. Hello. I'm going to introduce myself and verify the patient. My name is Temitope. You can call me Temi. I'm a student nurse from Mountain View College. I'm going to be inserting your NG tube today. May I know who you are? Your first and last name? Jackie Smith. Thank you, Miss Smith. Can you verify your date of birth? 06/03/1972. Thank you, Miss Smith. So, Miss Smith, do you have any allergy? Can you swallow? Good. I have been able to see in your handpill that you can drink water while we are inserting the tube. So it's okay for you to drink water when I'm inserting the tube. Like I said, I'm here to insert your NG tube. I'm going to have this close to you, your empties basin in case you feel like throwing up, a tissue within reach for you, and here is a cup of water with straw. You are free to sip water while the procedure is going on. Is that okay? Do you understand? Fine. So I'm going to be adjusting the bed into working height, pulling down the rails on this side. So the next thing is I'm going to be assessing for cough reflex and gag reflex. So Miss Jackie, can you please cough for me? Good. Perfect. Can you gag? Perfect. Okay. The next thing I'll do is I'm going to choose nerves. Miss Jackie, I want you to please use one finger from your right hand to cover your nose. Breathe in, breathe out. The other side, breathe out. Perfect. Okay. I have been able to see that Miss Jackie is good. She can breathe in and breathe out. So the two nerves are okay. She doesn't have anything like injury nor surgery in either of the two. The next thing is I'm going to be assessing her skin for skin break tissue. I'm going to be using my pen light. So I'm going to shine my pen light. Miss Jackie. Sorry. Okay. She doesn't have any bruises, any break in skin. Miss Jackie is looking good and she's good to go for this procedure. So that being done, I'm going to let her know um, that she can raise her hand as a safeguard. Miss Jackie, please, in the procedure of insertion of the tube, raise your finger up for me when you feel like you're gargling or you are very, very uncomfortable. That will tell me to stop. Is that okay by you? Do you understand? Thank you. So I've been able to tell her that. The next thing I will do is I'm going to place the towel over her chest. So I'll be placing this towel over your chest. This is to protect your clothes. So, and what I'll do next is I'm going to be preparing 3 tapes. The first tape will be 4 inches long, which is going to be used to safeguard the tube on her nurse. The 4 inches long tape that I cut, I'm going to part it into 2 equal parts, but not the complete. Oh, this is not looking good. Brush, let me take another one. So I'm going to part this. Good. So here you go. I'm going to leave like 1 inch, which I'm going to place on the nostril. So I'm going to stick this to the edge of the bed, right here. I'm going to take the second one, which I will use to fasten the tube to our dress, right here. And the third one, the smallest, which I'm going to use as the marker, right here. Okay, I'm done with that. Now, Miss Jackie, we are about to start. Before I do that, I'm going to take my Salem Sum out of the bag. This way. I take it out of the bag. I'm going to be measuring by placing the tube on the tip of the nose, from the nose to the halo, and from the halo to the sniffer process. Here I go. Right here to the halo and to the sniffer process. By my measurement, I have 43. So the smallest tape that I have, I'm going to fix it on this side, 43. So when I'm inserting the nose and I get to this level, to this length, I'm going to stop. Now, the next thing I'm going to do is I'm going to lubricate. For the sake of this video, I don't have a lubricant, but I'll assume I have a lubricant here, a water soluble lubricant. I'm going to lubricate 4 inches of the tube with the lubricant. So I'm going to put the lubricant. I've been able to put the lubricant. So the lubricant is here. Now I'm ready to insert the tube. The instruction on the order is do not force. I'm not going to force it, but I'm going to gently and warmly insert the tube. Miss Jackie, I'm going to insert the tube. You okay? Please don't forget, here is your cup of water. You are allowed to drink water while I'm inserting it. And don't forget again to raise your hand if you are feeling uncomfortable and you want to gargle. Are you ready? So I'm ready. So. So I reach the length at which I taped, where I put the mark. That's my marker. So I stopped, and the tube has perfectly entered. So the next thing I'll do is I'm going to provide safety by using the tape that I pad into two. I'll put this end on a nurse, on the tip of a nurse. I'll tape it down. I'll make sure one side, the right side, goes towards this side, stick it on, and the other side comes here, just to safeguard the tube. I've been able to safeguard the tube on a nurse. Then the last step, which is to provide another safety by putting the fastening the tube on her dress with the head of the safety pin. So here is my safety pin. So I've been able to insert the tube while the patient's head is in forward position, with the neck rest with the shin tilted forward, neck resting, shin tilted forward, resting on her neck, and the neck in hyper sensitized. So I've been able to do that for the patient, and in order to verify correct placement of the tube, I'm going to make sure there are two ways to go about that. Is either we use the x-ray or we test by the pH level. For the purpose of this video, after x-ray, we have been able to affirm that the tube is rightly placed. So I'm going to take off my hand glove, perform hand hygiene. That is that for the tube insertion. So I'm going to lower the bed, put the bed back. I'll lower the bed, and so I'll perform hand hygiene. I'll take off this. I can take off this. So again, I'm going to now I'm going to remove the tube. The first thing is I'm going to perform hand hygiene, and I'm going to put on a new glove. I'm going to put on a new glove. Verifying the patient again. Jackie's neat. Okay, perfect. Now I'm going to adjust the bed to a working height. I'll make sure the bed, then I'll pull down the rails. Then again, I'm going to put the towel on her chest, and I'll make sure that she can reach her empties basin, a cup of water, and a tissue paper within reach, so she can access them easily. The towel on her chest. So the next thing I'll do is I'm going to remove the suction. If the tube is connected to the wall suction, I'm going to remove that, and I'm going to take off the safety measure. From the first thing is the safety pin and the tape I have fixed here. I'll take off that, and I'll take off the one in the nose right quickly. So I'm able to take that off too. Now, and I'm going to have my patient have a deep breath, and I'm going to ask her to please hold the breath. Miss Jackie, please, I want you to have a deep breath, and I want you to hold the breath because I'm going to take off your tube. Is that okay? Good. Please take Deep breathing. Okay. I'm going to be carefully and quickly remove the tube. So I'm ready to remove your tube. You ready for me? Good. So I've been able to remove the tube, and then I will make sure I discard, dump it in the trash immediately. I'll make sure I dump it in the trash immediately. So the next thing I'll do is I'm going to perform hand hygiene. But before I do that, I'm going to I remove my gloves, perform hand hygiene. Then I'm going to provide care for the patient. In case she needs to be cleaned up, I'm going to clean her. Then if the patient is allowed to drink anything, like Miss Jack, she's allowed to drink water, you can drink. So that is that for the removal of the teeth. So I'm going to take all this off. The next thing I'll be doing is I'm going to bring the bed down. I'm going to lower the bed and make sure the patient is comfortable, because I'll be doing the ostomy care. Now, for the ostomy care, I'm just going to make sure that the patient's head is in Fowler position, a supine or a Fowler position, not hyperextended like I did for the tubing, but with this patient, her head is rightly placed in the Fowler position, and I'm going to make sure I verify her order and confirm name and date of birth. Hello, how are you? My name is Temi. Can you please confirm your first and last name? Jackie Smith, 0307 1972. Thank you. Perfect. I'm going to perform hand hygiene. I'm going to put on a new glove. So I'm going to put on a new glove. For this patient, I'm going to assume she already has a pouch on her, and I'm going to drain into a bedpan. For this, after I confirm whom she is, like I assume now she has a pouch on her, I'm going to drain that in a bedpan or into the toilet. And what I will do next is I will have a warm water. After draining, first thing I'll do is I'll take off the clamp, because it's reusable. I'm going to put the clamp, keep it for reuse. So I'm going to drain the water into the bedpan or to the toilet. After doing that, I'm going to make sure I clean the stomach with a washcloth and warm water. I'm going to put the washcloth in warm water, and I'm going to clean it after I've removed the pouch. So now, then the next thing I'll do is I'm going to take off the hand glove, perform hand hygiene. So take off hand glove and perform hand hygiene. Now, for the case of my patient, now I'm going to assess her skin. I'm going to be looking for the color red, which Miss Jackie has. If it is dark or blue, I'm going to report to the provider. But since Miss Jackie has a color red, which is the color I'm looking for, it's appropriate. Now, after hand hygiene, I'm going to put on a new glove, like I said. So, and I'm going to make sure I clean the stomach with the warm water and a washcloth. So if I'm going to clean the stomach very well, I clean it well. So I've been able to clean it. I'll put this aside. So I'm going to take off my hand glove, because I have just cleaned the stomach. So I'll take off my hand glove. I'm going to put on a new glove. So for Miss Jackie, I'm going to be measuring, using the measurement stoma to measure the stoma, the flange. I'll use the measurement stoma which I have here. Please, before I go on for Miss Jackie, I forgot to verify her order. I know she has a flange which I'm showing, a scissors, a measurement for the flange, the clamp, the pouch, a waterproof pad, the washcloth, and warm water. I forgot to do it earlier, but just remember I didn't do that, so I did that. I've been able to verify her order. Now, with that, after I've done that, I can now use the washcloth and warm water to have cleaned. Then I've done the hand glove. I took off the glove. I now have a clean glove. Now, for me, after I've cleaned that, what I'm going to do next is I'm going to measure. I'm going to take the flange out of the bag, and I'm going to measure the stoma. So I'm going to make sure the measurement is a 1/8 inch larger or 1/16 inch larger than the stoma. So with what I have here, oh, this is too big, too small, too small. Oh, this is a perfect one. Okay, this is a perfect one. I have it. This is the one I'm going to use. So I'm going to put this one at the back of the flange right here. So I'm going to have it. Looking at what I measure here, I have 45. So I'm going to be cutting this with my scissors. So I'm going to be cutting 45 with my scissors. So I've been able to cut 45. So I'll take off this. I'll take this off. So, and I'm going to place the flange first on the, I'm going to place the flange, apply it on the stoma, right, this way. Then I'll make sure I take off in order for this to be firmly fixed. Perfect. So I'm going to, yeah. Now I'm now going to snap the pouch. After I've been able to see that this is rightly fixed, I'm going to be snap the pouch right here. I'm going to be assessing for the seal. So it is well sealed, perfect. So there won't be any leakage anywhere. It is perfectly sealed. So now I'm going to put my hand in order to, oh, I forgot, before I start anything, I'm going to put the pad under the patient. Before I start anything whatsoever, I will have put the pad under the patient so that the bed will not be wet. Before I start anything with the ostomy, I will have put the pad. So with this one, after I've done this, I'm going to apply the pressure. I'll put my hand and I'll ask the patient to put a hand over just for us to apply pressure. So after doing this, the next thing I'll do is I'm going to use the clamp. Raising this up, I'm going to use the clamp. I'm going to clamp. So I've been able to clamp, and I put it in a place that it won't disturb the patient. So I have been able to apply the plush, so everything is intact. Then the next thing I'll do is I'm going to lower the bed, take off the bed pad. I'm going to lower the bed and lower the bed and make sure the patient is comfortable. And I'm going to tell the patient, please, in case you need me, you have your call light around you, please reach out to me. I'm going to perform hand hygiene, taking off my glove, perform hand hygiene. Then I'll put a rails back, and if you need anything, please call on me. So that is the end of my do. Then before I go, I'll make sure I document everything I have done so far, even from the beginning of the NG insertion. At the end of the insertion, I'll document. At the end of the remover, I'll document, and at the end of the ostomy care, I'll document. Thank you.